Hi, I'm Dr. Amber. I'm a small animal rehabilitation veterinarian who specializes in healthy aging and advanced geriatric pet care. And what I wanted to do today is answer a question that I get often, but people are afraid to ask. And it's, what does end of life look like? So when you've decided and your pet has told you that they are ready to leave and that you don't want to have them have a natural passing, because natural passings can take days to weeks, and a lot of times that's where we start to feel things aren't okay. When our pet starts to shut down, we decide to elect for euthanasia, which is completely fine. And it is okay to say those words, and it's okay to make that decision, because you're ultimately not making that decision. Their body is making that decision and you're listening. So end of life looks a little different with every practitioner, every vet that would come and do this with you, whether you come to a clinic or whether you have somebody come to your house. What typically happens is when you're ready and your pet is calm and everything is okay, I give a first shot, which is basically like falling asleep for anesthesia. It's an injection usually. It doesn't hurt, but most pets react when they get a little needle poke. So a lot of times I'll have my owners scratch or kiss their heads, or I feed them pieces of birthday cake and whatever I can feed them to distract them from that shot. The one I use takes about 10 minutes for them to calmly and slowly fall asleep. And then when they are totally, completely asleep and they can't feel anything and there is no pressure and they are not scared, I give a second injection, which allows them to let go and pass. It is usually pretty quick, the second injection. Most of the time it is really graceful and calm. But again, with some of our pets, they have chronic conditions and diseases they've been dealing with. So sometimes they will take a big, deep exhale and let go. Sometimes they might take an exhale after they're gone, and that's just all the energy in their body leaving. Sometimes they will do other things, but remembering that most of the time, our pets are holding themselves together and making everything look a little more calm than it really is. So if you do elect a euthanasia, remember that they shouldn't be painful, they shouldn't be stressed, it will be okay and calm. And in the time that you have with them before they pass, tell them their stories, tell them how great they are, your favorite trips, why you named them what they are named, where you got them from, and just talk about all the good memories, because it's better to have the end be calm and full of happy conversation and remembering their life than just waiting for it to happen. And there are great at-home resources like Lap of Love. Most areas have vets who do at-home services if that's where you want to have it done at your house. If you don't want your memory of your pet passing to be in your house, it's okay to have it at a clinic. It doesn't make anything worse. Just do what you can to make it as calm as possible. I love feeding birthday cake sticks and Oreos because dogs love them. If they love fillets, Doritos, whatever, bring your comforting, happy things to make the passing okay for everyone. And if you have questions, talk to your vet before. Pre-planning is a big deal. Pre-planning makes it less scary, lets you know what's happening, and makes things calmer in the end, because that's what we want, a calm end. Okay, if you guys have questions, feel free to DM. Otherwise, have a great day.